Good morning, everyone. Today I am posting from a different location. I'm actually at home since we have a snow day in my Grass Valley office. So I am Dr. Mitra. I am the owner of Capital I Medical Group. I'm your ophthalmologist in Northern California with two locations, one in Roseville and one in Grass Valley, which is currently under 2 or 3 feet of snow, not quite sure. Um, so I was in my practice, I help patients develop their best vision so they can live life and enjoy it fully, enjoy their hobbies for years to come. The discussion for today's Facebook Live is, am I a good candidate for Botox? So we're going to start with exactly what is Botox, what do people use it for, and then we'll go from there. So essentially, Botox is made from botulinum toxin, a very diluted form of that has been used for years and years in order to minimize the lines that come from facial expressions and kind of smooth out the appearance of these lines and prevent them from forming, essentially. Um, Anybody really can be a good candidate. So it has some medical uses. Today we're going to focus on cosmetic uses. And essentially, the cosmetic uses include fine lines that form, the number 11 signs that form here. Sometimes the eyebrows, there's a muscle that brings the eyebrows down and it causes more heaviness over the eyelids. And so placing it properly, it will help open up these lines and also lift the eyebrows. It can also be used for expression lines. So you may not be able to see mine as much, but expression lines that form an orbicularis muscle going around the eye, and you can have these fine lines that develop and sometimes becomes deeper. It basically becomes a scar tissue over time because that muscle continues to contract. Other uses, when you have forehead lines, lines that develop in the forehead, it can be used to minimize those or even smooth them out or prevent them from forming. For some patients that have prominent jaws, masseter muscle, it can be used there to kind of minimize and give more of a rounded look rather than a more angular look to the jaw. With some patients, it actually helps with biting the jaw just biting down at night. It can help with that also. What else? Other requests for a lip flip. People tend to use it right above the lip to give a little bit of a turn to the upper lip, make it look a little bit fuller, besides using fillers in the upper lip. So the question that comes up, should I use it? Where should I, as a patients ask me, well, should I be using it? And should I, would I be a good candidate? Essentially, my response to my patients about any sort of cosmetic procedure, whether it's eyelids, surgery, or anything else, I let them know that really it depends on what bothers you. So, for instance, for me, when I started developing, when I started seeing the frown lines, I would say probably about more than 10 years ago, I decided, okay, that's not what I like to see. So I started using Botox. So I have minimal lines here, if any, and you can still see that I have some movement in the forehead. So it's not like you have, people are worried about this frozen look. It's not like, you won't be able to have expression. It just depends on how much is used. But we're trying to minimize. For me, it was a matter of minimizing, lines on the forehead, giving more of a refreshed look because, well, by relaxing the muscle above the brows, it actually does give a slight lift. So there's less of a heaviness over my eyebrows. And so that's what I wanted. More recently, I'm playing around with expression lines, injections, but that's about as far as I have gone. Um, So if you, for any cosmetic procedure, if it's something that bothers you, then you ask your surgeon, you ask your doctor, and we can help you come up with ways to resolve it. And I'll give you an example. So more recently, I'm beginning to be bothered by the puffiness under my lids. So I know up to a certain point I can kind of hide it by using fillers, but I know that the time will come where I will need a lower lid blepharoplasty. So, starting to do my research and finding the person to take care of that is going to be important. For you, you don't have to have anything done, but if it's something that is beginning to bother you or you want it changed, whether, it's skin texture or these frown lines, certainly we can help you by using Botox, to minimize those lines and actually smooth it out. Another question coming up, do I have to keep using it? How long does it last? So Botox usually lasts about 3 months, 3 to 4 months, they say. And if you start using it, it doesn't mean that you have to keep going. But if you do it regularly, every 3 months, if you do have lines that have formed, they will minimize, they will smooth out, and you won't be able to notice them as much. And so, but at the same time, I have patients that use it for a special occasion like a wedding or a birthday or an anniversary or a trip. They use it, they probably 2 weeks, start 2 weeks prior so that they have the results by about 5 to 7 days afterwards. And then they don't until next year. It really depends on what you like. However, with me, I know when it's wearing off. I know that I can tell when it's beginning to look heavy, and I prefer to continue the treatment and maintain it and keep it going. So it's all personalized. The amount that needs to be used depends on the heaviness or the depth of the lines that you already have and what you want to accomplish. So less is more. You can always start with less and see what results you get and whether or not you want to continue or increase it the next time. I always tell my patients I'll start with a Botox recipe. So I will figure out, okay, how many units in what area, because I kind of know what results I would get with that. And then depending on how the muscles that they have reacts to the Botox, then we can always adjust that Botox recipe for the next visit. So if you have any questions, if you are in the Northern California area and you want to be seen and discuss your options as far as Botox are concerned, give me a call. You can get on the website www.capeyemed.com, CAPEYEMED.com, and I'll be more than happy to take care of you. Otherwise, I'll see you next Monday, 8 a.m. Hopefully, it won't be a snow day. I'd like to get back to work. Otherwise, have a great week. I'll talk to you soon.